All right. Welcome everyone to Wellness Wednesday. My name is Hannah Khan. I am the founder and clinical director of the Bloom Center for Motherhood, which is Texas's first and only holistic, exclusive perinatal intensive mental health program that's designed for moms that need more than 1 hour once a week therapy. Our program is very holistic, so we incorporate art therapy, yoga and mindfulness, mother baby attachment and bonding support. And so, a big part of that holistic model is our Wellness Wednesdays. So, what you're tuned into right now is the Wellness Wednesday, which we offer once a month. And it's an opportunity for moms in the community to hear from, engage, ask questions. With engage with perinatal professionals that support moms, for example, pelvic floor therapists, lactation consultants, nutritionists, just any kind of provider, perinatal wellness provider that supports moms. We want to bring them onto Wellness Wednesday and help them share what they know and tips and support for moms out there. And so if you're interested in being one of our speakers, definitely let us know. But this is something that we do on a monthly basis. And so this month is Breastfeeding Awareness Month. And so I am super excited about our guest today. We've got Jessica Koiner, who is from the Milk Box. If you don't already or haven't seen her page on Instagram, that is the name, the underscore milk underscore box. Did I get that right? Okay. Awesome. So Jessica is a lactation consultant, and she's going to be talking to us all about debunking those breastfeeding blunders, that come from myths, just misunderstandings, misconceptions that are kind of going around or that we might hear about. And she's going to kind of break some of that down and also give us some simple ways or tips for moms to increase their milk supply and also just some support around how to make certain feeding choices. And it's okay. All feeding choices are okay. And so, yeah, so we'll get into all of that. But I'm really excited. Jessica, welcome. Thanks for being here.
Thank you. I'm so privileged to be here. It's an honor.
Thank you. Yeah, I'm really excited about all the things that we're going to be talking about today. But you know what? To start, um, I just want to clarify because I think this gets misunderstood or interchanged unintentionally. But to start out, tell us the difference between a lactation specialist and a lactation consultant, because there's a huge
Yeah,
difference, right?
there is. There's a big difference. And I think one of the biggest things and the misconceptions is how we become a lactation consultant and what that process looks like. So I am an IBCLC, so it's an internationally board certified lactation consultant. And essentially, that just takes a longer period of time with more education. So, an IBCLC, what you know when you see that designation is that they have some kind of biology degree, they have a bachelor's in that degree. They have gone through 95 hours of lactation specific education, and then they have sat boards after they have gone through 500 to 700 hours of clinical education underneath another IBCLC. Um, there are several different pathways to get there, but for the most part, that's the one that most women go through in order to become an IBCLC, and that's what I went through. So we are different from CLCs, CBSs, because those people go through education courses, but they don't have the same level of clinical experience, nor do they have to sit for a board exam. And that the IBCLC, the company that accredits us, goes through that process twice a year. So we have to wait and we have to sit for boards and we have to study. And then we have to wait to see if we've passed. And then we get our licensure. So that means we can practice with that designation. So it's a lot of work to get there, but it's incredibly worth it.
Yeah, gosh, thank you for clarifying that because a lot of moms don't know the difference. I remember a few years ago, I didn't know the difference either until someone who was a lactation consultant explained that to me. And I was like, oh my God, this is so important to understand this distinction, just to be informed of who we're working with.
Mhm.
And I think it's good to know these different credentials because not everybody knows what those letters after our name are, right?
It's
So
true.
yeah, so thank you. But it sounds like the IBCLC designation credential takes a lot of, like, there's some intense preparation, training, right, experience and the boards, right? It's a whole process.
Yes, Exactly. And I think it gives credit to the fact that we have a lot more scientific backing to some of the things that we may be able to discuss. We're not technically allowed to diagnose anything as a lactation consultant or an IBCLC, but we have more experience in the diagnostic process, in the referral process, in coordinating and networking. Now, that's not to say that there aren't incredible lactation consultants out there that aren't IBCLCs. Um, but I like to equate it to the difference between a nutritionist and a dietitian. The dietitian is exactly the same in that they have to go through a higher level of education and testing in order to become an RD rather than just a nutritionist. Anybody can become a nutritionist or call themselves a nutritionist. Any mom who's had 6 babies could call herself a lactation specialist, but you can't walk around with IBCLC unless you've done a little bit extra work.
Yeah, yeah, thank you. That's such an important distinction. There's a lot of work and energy that goes into acquiring that. And so, yeah, so thank you for that. So let's dive right in. You work with moms that are postpartum or pregnant as they're preparing for their postpartum, and so do we at the Bloom Center. One thing that comes up a lot is there's so many mixed messages and mixed opinions
Mm.
about breastfeeding and or feeding choices. And so I'm curious to hear what are like the maybe let's say the top three common breastfeeding mistakes that moms tend to make that arise from maybe myths, misconceptions, misunderstandings. So what would you say are some of like the top three that you see most often that you help moms with?
The top three things that I see most frequently sometimes are not on the fault of at all the mom. Um, but biggest thing that I see is moms feeling concerned that they don't have enough breast milk. And that can be for a myriad of number of reasons. Milk, your mature milk doesn't normally come in until about 4 to 5, maybe 6 days after delivery. And that can be affected greatly by a ton of other things, long labor, short labor, lots of medical intervention, a variety of things, C-section, all of that can affect how long it takes your body to recognize that it's time to go into that production phase. But what I find most frequent is that moms often doubt themselves that they can do it. And the number one problem for a mom who gives up is that she's had no support or a lack of support. So if she goes to the pediatrician per se, and this is what I hear a lot, they will look at baby's weight from the moment that they were born within 2 to 3 hours after they were born. And then they'll look at the weight when they go in for that first pediatrician appointment, which is give or take, 5, 6, 7 days after they've been delivered. And the downside to just looking at those two numbers is that there's a lot that can happen in between then, and there's a lot that happened before baby was born that can affect their weight. So this number that they're looking at may be greatly affected by the number of liters of fluid mom had via IV. It could be that she went through a C-section and baby didn't get all that water squished out of them by going through the vaginal canal. There's a lot of reasons why this number might be a little bit elevated. And then when we look at this number, it's not exactly the best picture of that weight gain or loss. So we have to take into consideration that there's some variables that affect that. And I don't often hear pediatricians explaining that at all. And so the detriment there is they see a baby with 12% weight loss and they send off all these red flags, and mom goes home thinking that she's a failure, that she doesn't have enough breast milk, that she's not able to breastfeed, that this is completely not going to work. And when the pediatrician says you must supplement for the safety of your child, of course they're going to do that. But then they think that means that I can't do this. That means that this is a forever situation. I'm not going to be able to breastfeed. So that's the number one thing that really breaks my heart. Um, I personally experienced that myself, which was one of the key motivators that I try to get this across to everyone because of how detrimental I've seen that to be on mom's mental health. Um, and just the overall experience of breastfeeding initiation when they're already feeling so bogged down by failure, it is a really hard thing to come back from. And then the other thing that I see a lot is moms using bottles incorrectly or using the incorrect bottle structure. So we can talk a little bit more about that in the future if you'd like. But there's this particular shape that we would like to use so that we can initiate and perpetuate proper oral development. So that's something that I find very, very helpful to talk about because, like you said earlier, every feeding choice is different and every journey is different. Using bottles is not bad by any means. But we just need to know how to use them properly, how to feed baby properly, how much to feed baby, and what bottles to use so that we can kind of go between the two, breast and bottle. Or if we are going to only do bottle, that we're creating proper oral development for the longevity of your child's health. It's not just about breastfeeding. So that's two topics that I really like a lot. And then I'm trying to think of a third topic that moms typically come to me with. A lot of the times parents have fear of, mastitis or clogged ducts or, any number of those mishaps that tend to happen, cracked nipples. Um, and one of the things I like to talk about a lot is not everybody has the tendency to get mastitis. And there's a new wave of education on how to deal with mastitis, that we've discovered over the last couple of years. And a lot of the times, doctors and nurses in the hospital will say, do heat and then, pump or breastfeed and then ice. And we have this new protocol where we're basically like ice, 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 ibuprofen, 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 because mastitis is an inflammatory issue. Same thing with clogs. Clogs are not really a real thing. It's not that you have a clog inside your breast, it's actually constricted tissue. So we're looking to open up the vessels and allow movement rather than stagnating that milk tissue or milk production. And so there's a lot of things, there's just so many variables. I think if I could say one thing about lactation, and not because I'm a lactation consultant, but because I'm a mom, I think that having a lactation consultant to come and see every mom is so helpful, even if it's just to give you that vote of confidence that you're doing the right thing, that you're holding baby in a proper position, that you're not breaking your shoulders, freezing and holding your baby in this certain position that's just not sustainable for you or the baby. So to equip parents to know you can do this, you are good at this, your body was made to do this. Let's just figure out how to make it easier for you guys. And, I'll give each parent several tips to do that, depending on what circumstances they're facing.
Oh my God, Jessica, everything you said, I'm like, I needed to hear all this when I was postpartum and trying
Me
to
too.
figure out my nursing, struggles. Everything just hits so close to home because these are the messages that moms need to hear that you can do this, and with support, with the right kind of support, you can get through it. Is it going to be hard? Yeah, it is hard. It's a new thing for you and for baby, but with the right level of care and that kind of support with a lactation consultant, they can work through it. And there's so, like you said a couple times, there's so many variables. I think we tend to think very black and white, right, of how this is to be done, but it's not black and white, and there's so many different possibilities and so many different variables. I still remember the day my doctor told me that the pediatrician said that that there's too much weight loss and we need to supplement, and how an already anxious mom, right, who's already second guessing everything she's doing as a first time mom, is going to be like, okay, here we go again. I'm totally failing
Yes,
at this whole mom thing. Like, just can't
exactly.
do this right. Like, something I thought would be intuitive, natural maternal instinct, none of that's going here, right? Something must be wrong with me and my
Right.
breast milk and supply and all of that, right? And I think having that kind of steady care is really important. I remember talking to a lactation consultant like once every few, like from the hospital, but versus having someone steadily available that you can reach out to, ongoing care throughout that journey until we get to a point where we've got it somewhat down, whatever
Hmm.
feeding choice we're choosing, right? I think that's another thing that I did this, I underestimated how much support I'd probably need from a lactation consultant at that
And
time.
I think truly as first time parents, we always do. We prep for labor, we prep for delivery. Those things are going to happen. Lactation is something that takes you, the baby and the mom, and everybody else around you working together to make that happen. And I love that my job is one where I get to stay alongside these families long term. I get to walk with them consistently for months, if not years, should they choose to allow that to happen. And I really appreciate that that's a gift that I get to give them, that I get to stick it out with them. I get to walk through weaning. I get to walk through solid introduction, sleep regressions, any of those types of things. I get to stay with them. And then most of the time I get to be their friends. I have so many moms, they're so funny. They'll text me after months of not seeing me, and I'll check in on them because they come to my mind, and I'm like, hey, how are you doing? And they're like, we're going 8 months strong, blah, blah, blah. And then they'll be like, hey, is this weird? Like, can we be friends in real life? Can we like go get coffee? And that is the highest compliment. If I can be a friend, that's a wonderful gift, not only to them, but to me. Like, I'm in this for the long haul. I'm in your corner. I'm going to support you. I'll never make you do anything that you don't love or feel comfortable with. And I get to be this sounding board. So if something doesn't, like, I'm not the world's expert in lactation. I know that full and well. I'm every day learning something new. But if I get to be a sounding board for them, and I say, that might not work for you. Let's try this. Or, hey, that might work for you. Let's try it. You text me, tell me how it's going. We're going to bounce ideas off of each other and see, okay, that's not working. Let's pivot. And it's just so fun. It's just so nice. It's like a great puzzle.
Yeah, it sounds like your work is so like mom led. Like what does mom want? What's working for her? What's not working for her? What choice is she leaning towards and working with that? And then as needed, changing and pivoting whenever necessary. And I think that's really important for moms to feel seen, heard, and understood in this journey
Yes.
for what they want. And
Mhm.
then also for someone to honor that in ways that are important to them. And this brings me to something you mentioned earlier about whether we're bottle feeding or breastfeeding exclusively. I think making that feeding choice, right? And all
Mhm.
feeding choices are okay as long as they work for your family and
Yes.
work for you and work for your baby and is good for your mental health. I think that's a really important one. I remember when I was postpartum, I had to make the choice to stop breastfeeding because my mental health was starting to struggle and
Mhm.
I had to make a choice. And after I did stop, I started to feel so much better. And then I decided to relactate and I restarted the whole process because
Look
I was
at
like, I
you.
still, yeah, I can't. I think about that time and I'm like, I actually did that. Like, wow, that's wild. How did
That's
I
so
do that?
cool.
But I knew how much I wanted to nurse and breastfeed, and so I was like, I'm gonna pause for now because my I was not sleeping. I had an emergency C-section. I was a bit of a hot mess, and so my loved ones were like, you just need to take a break and get some rest. And I did that for about a week. I
Mhm.
paused and then I relactated. And my supply wasn't as good as it was initially, but that's fine. At least I was getting
Yeah.
something. I had a pumping schedule. And then eventually I ceased, but it was on like I did it on my terms. I didn't do
Yes.
it. So I think it was so important for me to remind myself as I look back at that and for new moms that yes, nursing or your feeding choice is important, but so is your mental health. And when one
Absolutely.
choice starts to, with the other one struggling, then we have to do something about that. And so
Yes.
the messages around, yes, breastfeeding is beautiful and lovely and so beneficial for both mom and baby, but if your mental health is compromised, then it's no longer a choice that's good for you for now,
Absolutely. Yes,
right?
I completely agree. I think there's a saying that a lot of my doula friends talk about, the distinction between pain and suffering in labor. And I think very similarly in lactation, we have to look at the difference between like struggling and suffering. Like, we can't be suffering. We could be struggling, and with support from somebody, should you choose to, trust a lactation consultant or a nutritionist or a bodywork specialist or whomever ends up, coming into your village. Then we can help guide you through that. But at some point, there are some circumstances where, if I love you as a provider and you're my client, and I see that there's a detriment to your well-being, then I'm going to make the comment of, what if we considered what this would look like. There are hundreds of people walking around this planet who never breastfed and are alive, maybe not thriving as much as some other people, but they are alive and they are okay. And everything's going to be fine. And if you're not fine, then it's not worth it. One of the things I like to tell parents specifically to do as a tip for the newborn phase, specific to getting rest and being moderate and understanding that there's a level of pause that sometimes we need to take as families when we've gone through the trauma of what may be, labor, delivery, birth, all of that. And I call it the rescue method. And I actually believe I've stolen this from somewhere along the lines, but whoever said it called it the rescue method, and I love it. Um, and what this is the suggestion of picking a period of time during a 24-hour period where mom pumps and someone else bottle feeds. And why this is helpful and this distinction between just like pumping and bottle feeding is that oftentimes when we get the pump to work well for you, which is another variable, but if the pump is working well and comfortably and effectively, then pumping can take 20 minutes, 25 minutes, and then you're done. Whereas those of us who have newborns know that a feeding can take anywhere from 30 minutes to an hour. And that's including, diaper changes, reswaddling, being on one breast for 30 minutes, keeping baby awake, swapping them to the other side, asking for somebody to get your water, you having to go pee. I mean, there's so much that can happen in that span of time. And not only are you doing all of that, but there's also this new finesse of breastfeeding that you're learning. It's like, you know, me putting my 4-year-old on a bike and telling her that she has to go to the grocery store to get food because she's hungry. Like she doesn't know how to ride a bike efficiently. She can't go there all by herself. It's hard. It's a lot. So what I tell parents to do is I'm like, let's just employ this rescue method and just try it. If you don't want to do it, great. But if you have a supportive person, whether that's their mom or their husband or their partner, whomever, then mom can pump, she can go to sleep. She can sleep through a next feeding 4 hours. Then she can have somebody who wakes up and bottle feeds in the middle of that period of time. And then when the baby wakes up again, she just hops right back on the schedule with that baby. And that I'm saying it's easier, it sounds easier, right? Than it will be, in fact. And you're going to have to do mom math and all this other stuff. But the idea is still there that mom gets to have some isolated rest and someone else gets to rescue her because the mom is just as important as the baby. Like everyone wants to hold the baby, but who's going to hold the mom? Right? Like somebody needs to take care of her. And sometimes just having those 4 hours of sleep is super crucial. So crucial. And another thing that I like to tell parents specifically, because I think that this was really helpful in this mental shift for me. The phrase like sleep when baby sleeps is so commonly thrown out all the time. But for some women, the sleep aspect during the day is like a punishment. They're being forced to be away from their baby, and maybe that feels less mentally healthy for them than for you to say, go for a walk when baby sleeps, or take 3 showers when baby sleeps. Whatever that thing is that makes you feel like a human, do that. If it's not sleep, that's okay. But whatever it is that restores you, if it's sitting outside in the sunshine and reading a book for 15 minutes, you may feel so restored by simply taking that little segment of time to be a human that it's going to change the rest of your day. So those are two little things that I often tell parents to do in the very early stages so that they don't lose themselves in the midst of this really hard initiation into parenthood.
Yeah, I love that. Really emphasizing how to take care of yourself while you're caring for baby and while there's a baby to nurse or care for, right? And I think as moms, first-time moms, or just postpartum moms, we forget that. We forget that there's different ways that we can do this, and there's different ways that
Mhm.
I can care for myself. And it doesn't have to be this cookie cutter method of self-care. Do what works for you. Do what feels rejuvenating for
Mhm.
you versus what you may have read in a book, right? Like, and that's the
Exactly.
great thing about working with another person steadily is these options that we can brainstorm and come up with, like what works for you versus go by what's in a book, right? Because it's going to be
Mhm.
different for everyone. And gosh, the breastfeeding or feeding journeys are so personal and
Mhm.
unique for each mom. and for each phase, like, what worked now might start to evolve after a few months and look
Yeah.
different. And that's
Yes.
okay,
Yes.
right? Or like first few weeks versus a little bit later. So all of that to say that it's okay. There's a variety of ways to do this, and sometimes everything doesn't occur to us. But when you have another person to sit with you and talk through some of this, we can, oh yeah, I could do that. I could try this, right? Like just different options. Because again, as moms, high anxiety moms, it feels like this is it, catastrophizing, right? 0 to 60.
Yes.
I'm just not going to be able to do this. I should just give up. I should just
Mhm.
stop breastfeeding because this is not something that's working. I'm tired. And I love the distinction between suffering, right, and
Mhm.
struggling, and how we don't have to suffer. There
Yes.
could be struggle, and with support, struggle becomes a little bit more manageable, and then less struggling, right, like
Yes.
later. And so I love these distinctions that you're making because that's really an important shift that we want. We want moms to hear that so that they can
Mhm.
shift that thought process. There's one thing that you mentioned that I don't think we talk about enough either is um, oral development of
Mm.
babies and the latch. Like that, I think, is another challenge that often comes up. So talk to us just a little bit about that.
Oh, that could be a whole hour long
Yeah.
conversation just in and of itself. Especially for someone who I've gone above and beyond the normal training to do a lot of like airway specific education. So, when, for instance, if you were to work with me directly and your child had any tendency or evidence of oral restriction in any way, the number one thing I'm going to do is I'm going to set you up and help you network and get connected to a bodywork specialist. So someone who's either what we call a CSFT, a CST, or a chiropractor. So CST is cranial sacral therapy, so cranium and sacrum. And they work on a lot of fascial movement. So the body is kind of like a little orange. And every time you peel an orange, there's all those little white things all throughout, right? And I could use the nerdy biology terms, but the fruit part is like the muscle fibers. And then we have all of these white fibers that run through that fruit that are like the fascia. And they're so interwoven in this orange. And very similarly, our body is like that. There's fascia from literally tip to toe that will affect the way that a baby feeds. So when I'm watching a mom breastfeed, I'm not just watching what she's doing, and I'm not just watching what the baby's doing from here to here. I'm watching what their toes are doing. I'm watching what their hands are doing. I'm watching what their neck is doing, what their
Hmm.
shoulders are doing. It's a full body experience. So to know specifically if we can see a baby that has any oral issues, we're going to set them up with body work so that they can start relaxing some of these tissues, moving some of these bones. Because a baby has all of these, fontanelles, all these little map pieces that look like Pangea. And their skull has this ability to beautifully compress and open so it can go through birth. But when they're out in the world, we need all of those to relax and settle into their proper places. The one most crucial component of that is tongue placement. Um, and again, this could be a huge rabbit trail for me, so I'll try to stay on task. But specific to oral development with babies, we want them to be able to elevate their tongue to the roof of their mouth like a forklift. And what that does is when the tongue lifts, it shapes the palate or the roof of the mouth. And the roof of the mouth is the floor of the face. So it's the floor of our sinuses, it's the floor of our eye sockets, it's the floor of our eustachian tubes. It is the base for everything else above here to function properly. And if the tongue isn't lifting, then that means it's not at 100% capacity, which means that we're probably going to have some feeding difficulties. Either there's going to be signs of compensation, like leaking out of the sides, or tight lips, or blisters looking, that we call them blisters, but they're more like calluses around the lips. There could be clicking, there could be lots of gas, there could be tons of hiccups. There could be acid reflux symptoms because, again, the tongue is connected all the way down here. It goes past the hyoid bone into the low diaphragm. It pulls up on all of that, causing this acid reflux symptom, when in truth, it may just be restriction. It may not be a digestive issue.
Hmm.
So, oftentimes, I'm sending parents to a bodywork specialist. And the analogy I give a lot is if a baby comes out of delivery, they have been compressed in fetal compression forever. And then they go through labor or, all of, even if it's a C-section, every part of that is a little bit traumatic. Just like a mom's hoo-hoo is going to hurt a little bit after labor. It makes sense. It's traumatic, but their body is like a rubber band stretched to 100% capacity at that level. It's got all the tension that it could possibly have. Our job as a naturopathic body work type of person is to then release some of that tension and see, let's say we go from 100% capacity stretch to 80. Well, what changes have we seen in this 20%? And are they indicative of, if we've gotten rid of this tension, are we still seeing signs that are indicative of ties? If we've gotten rid of some of this tension, we may never have to do a tongue tie release, a lip tie release, whatever, because we might regain all this mobility and function. It may be that they have a cervical nerve impingement and they can't feel this side of
Mm,
their face. We don't know that until we've relaxed some of this tension and given their body a chance to integrate into the new world that they're in, into doing this breastfeeding, which is so much more complicated than we would ever imagine. Suck, swallow, breathe is so difficult for them in the beginning. Um, so the oral development facet is so important to me. I tell moms all the time, you could tell me today, I don't want to breastfeed ever again. And I'm still going to tell them all the same things. I'm still going to talk about body work. I'm still going to talk about tongue position and movement and dexterity. I'm still going to talk about the proper bottle shape that we want, the proper pacifier, the proper movements,
hmm.
getting baby into tummy time. All of that is going to change their life forever. We see babies now that we're able to, for instance, if I'm working with a family and they have a toddler and the toddler has experienced all of these challenges with feeding, challenges with speech, challenges with swallowing, even challenges with walking. A lot of toe walkers have a tongue tie. So we're looking at how can we affect the change in this baby, which is like Play-Doh. They're so easily moldable and change in their body is so receptive. They want that change. They want to be relaxed. And so it's easy to change those things when they're babies. It's much more challenging to change those things when they're older. So we have myofunctional therapy, we have speech therapy, we have PT and OT because these challenges weren't either seen or addressed early enough. And it's
Yeah.
wonderful that we have these things, but now we have this beautiful ability to say, you know what? I think that your baby could do a couple exercises with their tongue. We're going to
Hmm.
work on the windshield wipers where we move their tongue left to right. And that could fix their problems and make their tongue click to the roof of their mouth and shape their palate. And then they'll never
Yeah.
have to have ear tubes, palate expander. There's just so much that we can do with oral development in the early stages that will affect them forever. Even, to the point in like, there are 45-year-olds now who are unfortunately being put on CPAP machines. That's too young for us to have a breathing and airway issue.
Hmm.
And a lot of that is connected to poor airway health, to poor breathing, and to poor palatal development. If we could just catch it here, then
Yeah.
we may avoid all of this heartache.
Yeah. I had no idea there was so much more to a latch than just a latch. This is so helpful, and your background in biology, is probably like really helpful in understanding and explaining this to moms, right? Because there's so many nuances to this. Like I said, I
Mm-hmm.
always thought it was you either latch or you don't latch, and you just get support to latch. But what I hear you say is you're not just looking at the latch, you're looking at the whole body, which I
Yes.
love because it's not just the latch, it's all these pieces working
Mm-hmm.
together to develop the latch. And right. So thank you. That's so helpful. And I hope the moms that are tuned in or watch this as a recording can really learn a whole lot from this. And I know we're close to being done with our time. We could go on and on talking
Yes.
about this. You could go on and on talking about this. This is such an informative discussion. I've learned a whole lot myself. I want to leave our moms with, a couple of tips that, moms, one of the biggest, right, fears is, am I, my milk supply? Is it, I just don't want it to drop and I want to increase it. And so, what are some basic things that you might recommend moms do that can really help with that?
It's a great question. And interestingly enough, we can actually help with milk production before baby's even born. So, not only I'm a nutritionist by education first. So not only do we have this whole facet of conversations about nutrition, but also one actual hands-on, and no joke, hands-on thing that we can do in the beginning is what we call hand expression or colostrum collection. So, most moms who are experiencing a healthy pregnancy can begin hand expressing colostrum, which is that early milk, at 38 weeks of pregnancy. So, make sure your provider says that everything's going well and that everybody's safe. And then you can actually start your hand expression process. I'm not going to promote my stuff, but I have education on how to do that available should someone want to reach out and do that. Or, I can easily teach that virtually. Hand expression is one of those crucial components that gives mom the ability to feel empowered to handle her own body in a way that she probably hasn't before. And by hand expressing, which means we're going to squeeze out some colostrum and collect it. And maybe we don't collect any colostrum, but we're still manipulating the breast tissue. Simply by doing that, we're already starting the process of milk production. Women who do this hand expression often have their mature breast milk shift happen much quicker because their body is like, oh, we're supposed to be doing something with these things that have been kind of in this little fallow field for a while. So doing that is super helpful. Another thing to think about is after baby's born, making sure that we're having regular milk removal at about 2.5 to 3 hours maximum for those first 2 weeks is really crucial. And that's because we want to create these consistent hormone peaks where we are stimulating the breast and giving it the demand that it needs in order to shift over into what we call lactogenesis 2, which is that prolific milk production stage. And then at that phase, we want to move milk out of the breast frequently because we don't want to get mastitis. We don't want to be engorged. And we still need to be able to keep up with baby. So we're telling our body, this is how much demand we're putting on our body. And this is how much we need to make. Now, in the very beginning, when babies are born, they need less than an ounce per feed. It's not like a lot of moms think, the baby comes out and they need like a whole bottle. You're just picturing them like chug-a-lugging this whole big bottle. And that's not how things are. In fact, in the first couple of days, they really only need 2 tablespoons per feed. So it's very tiny amounts, but it's the act of removing the breast milk is what maintains your supply. Now, in the
Mm,
beginning, there's a pendulum, and the pendulum is swung very hard to the supply side. Your body almost doesn't really care how much baby weight. It's just going to give as much effort to creating breast milk as possible. At about 3, 4 months, it shifts over to more the demand side of things. So that if you haven't caught any breastfeeding issues before 3 months, you may start to see problems at this point. Because if the baby's just been kind of riding your letdown, or coasting along with all of their reflexes that are happening automatically, at this point, that's going to change. And so a lot of times I'll have moms at 3 months saying, I've got a baby who's struggling with bottle feeding. All of a sudden, like she won't bottle feed. We introduced a bottle at 2 weeks, but we haven't really given a bottle recently, and now she won't take it at all. Or
mm,
I've seen a huge dip in my supply at this point. Tell me what's happening. Or I got my
mhm,
period back. Like, why is this happening? And that's just this big physiological shift that starts to happen at about 3 to 4 months. Um, Most of the time, this can be handled and we can kind of figure everything out. But I always like staying in contact with people when we get to this phase just to make sure we can kind of get over that hump and see that we've made it past that shift. So frequent milk removal is really helpful. Making sure that you are supporting your nutrition is obviously really helpful. We want to make sure that we're getting enough magnesium. We want to make sure we're getting enough protein. We want to make sure that we're drinking enough water. There's so many things that we could talk about with regard to nutrition. But the milk removal aspect is super crucial. Breastfeeding and pumping should not hurt
mm,
at all. So if there's a point at which it's painful, that's a red flag. You need support. Don't wait too long before you feel like a failure because you're not. It's just that you need some guidance. It could be that we just need to change the way you're holding your hand and all your problems go away. Or it could be that we're in for a little bit of a longer road. body work and a tongue tie release and all of these post-op stretches and things like that that we might have to do. But if breastfeeding is the goal, then we can get you there. Like those are the things we can do. So I think the biggest tip is figuring out if you have red flags, getting help. And
Yeah.
then milk removal frequently is really, really crucial in the beginning.
I had no clue. That's again something I've learned. Wow, before even birth, you could start to manipulate and possibly collect colostrum. That's
Exactly.
I didn't know that. That's awesome. Gosh, you are such a wealth of information, Jessica. Thank you so much for sharing all this with their moms. I'm sure this is going to be so beneficial for them. So, if moms want to find you or work with you or just find more information about you and
Yeah.
what you've shared so far, again, her Instagram page is the_milk_box, where you can find her information, tips, support, and ways to reach her. She provides services in home as well as in office as well. So you've got both options and virtually as well.
Yes.
Is that right?
Hmm.
Yes. Yeah.
Yes. And I
Awesome.
also do breastfeeding 101 classes. So that could be
Okay.
as a group, should you have like a couple friends that you want to, get together and we talk about what is lactation, what does it look like before baby in the hospital, first 3 days and the next 10 days. So I have it kind of broken down into these different phases. I also do that as a one-on-one consult. So we can just go grab a coffee. We can talk about all your concerns. That's even for moms who are having multiples, right? Like this is your third baby, but their first experience wasn't what you wanted it to be. Let's get you empowered to figure out how to do that. Let's give you the tools to feel more equipped to handle the situation better this time around. And I also have a couple resources on my website that if you don't
Okay.
want to pay for a consult, you can just pay for these little mini courses and they're $50. So it's not, you're not spending a ton, but there's, hand expression, bottle feeding,
Okay.
nipple shield use, all that type of stuff. So it's not a huge cost expenditure, but it gives you a little bit more education should you not want to pay for a full consult. So there's lots of different options.
Options. Yes, I love that. I love that. Thank you so much, Jessica. It was so
Absolutely.
nice. I've learned so much from you in just these 45 minutes. So thank you so much for your time today and for sharing all of this. And I will be sure to leave links of your page on our YouTube channel, and that way moms can get in touch with you quickly.
Well, thank you so much. I really appreciate you giving me the chance to chat a little bit. I love what I do. It's a very big passion of mine if you can't tell. So thanks for having
Yeah.
me on the video.
Thanks so much for being here.